Who are you? What's your, really what's your superpower, and why should you win this award?
I'm Valentina. I'm the founder and CEO of Daye. We've developed the world's first diagnostic tampon for at-home STI, vaginal infection, and HPV detection. The reason why we did it is because gynecological health screening is notoriously incredibly uncomfortable, and as a result, women avoid it. In the context of HPV screening and cervical cancer prevention, this is particularly important because when caught early, cervical cancer is entirely treatable. The superpower that we have is that we can contribute towards the eradication of cervical cancer as a disease within our lifetime. The World Health Organization, the FDA have all recommended self-sampling. And with the combination of regular vaccination programs, we have the opportunity in our hands to cancel a type of cancer, which is one of the deadliest female cancers in the world. Our approach to go-to-market is both direct to consumer and B2B, which enables us to have multiple touch points with our patients, both delivering directly to their homes, as well as through their doctor's offices, retail, etc.
You gave some really good examples on, that it's uncomfortable for screening and that, not enough people are being screened and we can eradicate cervical cancer. So that's a huge, it's a huge opportunity, and doing it in the tampon platform. That's awesome, right? So the question I have for you again is the same one we've been talking before. Anecdotes. What can you tell us? Again, about specific examples, either in the at any stage of development that you've seen where this is making an impact, and then we can abstract where you might go in the future.
Yeah, so I can give two very specific patient stories. The first one has to do with our HPV screen, and the second one has to do with our vaginal screen, which are both underlined by the diagnostic tampon technology. So with the first one, we had a patient with vulvodynia who had been avoiding her HPV and cervical cancer screens because she was finding them too painful. So with the Daye diagnostic tampon, she was able to get screened for the first time and actually identified that she did have a high-risk HPV strain, which was followed up by a cytology, which also came up positive. So she was able to start her treatment for cervical cancer earlier than she would have otherwise, because her condition prevented her from being able to take part in standard programs. Another thing beyond the HPV screening is the importance of detecting the exact vaginal pathogen which is causing the patient's symptoms, because vaginal symptoms are often very similar, discharge, burning, discomfort, and the sophistication of diagnosis is really subpar. So frequently we treat before we know exactly which pathogen is causing the condition, which leaves the patient stuck in a constant cycle of recurrent infections, dramatically impacting their quality of life. So we recently had this 28-year-old patient who for the past 10 years had recurrent vaginal infections. She was continuously treated, initially for thrush, then for BV, then again thrush, then BV. Her symptoms persisted. She couldn't find any solution. She couldn't exercise because her swelling was so painful. She couldn't have sexual intercourse. Her relationships were affected. Her self-confidence was affected. And in the last doctor's appointment that she had, she was actually prescribed antidepressants because her clinician believed that her symptoms were all in her head, because the clinician was prescribing the standard treatments for the vaginal symptoms that she was experiencing without any impact. She then used a Daye diagnostic tampon and realized that the real pathogen that was causing her symptoms was actually ureaplasma, which is a perfectly treatable pathogen, with a simple course of antibiotics, which she was able to obtain. And for the first time in 10 years, she could go about her daily life without the constant feeling of discomfort and embarrassment caused by persistent vaginal infections.